Hey everyone, and welcome. When you're studying homeopathy, there are some remedies you just have to know inside and out. Abrotanum? It's definitely one of them. So in this study guide, we're going to break down all its key features and give you the tools you need to really understand and, more importantly, remember this powerful remedy. Okay, so our story starts right here with this plant, southernwood. It's part of the Compositae family, and it has these wonderful old names like lady's love or lad's love. I mean, how great are those? These names kind of hint at its long history in gardens, where its fragrant leaves were given as little tokens of affection. Now, it's pretty fascinating to think about this connection to something so vibrant and alive when we consider the state it's used to treat.
And this right here is the absolute core image of Abrotanum. If you take away nothing else, remember this paradox. A child that is wasting away, looking old and wrinkled, but at the very same time is incredibly, ravenously hungry. This complete contradiction, that's the golden ticket. It's the central clue we're going to keep coming back to.
So here's how we're going to tackle this. We'll start by getting to know the remedy's source. Then we'll lock in its three most unforgettable features, the core trio. After that, we'll explore the unique mental state, break down the body's symptoms, and finish up with the practical rules for using it. It's a clear roadmap to truly getting Abrotanum.
Okay, let's get right into it. Section 1. Meet Abrotanum. Before we get into all the nitty-gritty details, let's just establish the fundamental story of this remedy.
So, what is Abrotanum at its heart? Well, it's a huge remedy for profound wasting, or what we call marasmus. But what makes it so unique is its strong link to rheumatism and that really fascinating pattern of alternating symptoms. From a homeopathic perspective, it's often tied to what we call the tubercular diathesis. Think of it as a kind of underlying constitutional weakness, a tendency towards wasting, with the chronic miasm of psora often lurking in the background too. All right, I want you to really picture the patient here. We're often talking about a child who is just profoundly emaciated. Their skin is loose and flabby, hanging in these wrinkled folds that give them this strange old appearance. And a key physical sign is this profound weakness in the neck. I mean, their neck is just so weak they literally can't hold their own head up. And don't forget, even with this withered away state, they are a chilly patient.
All right, pay close attention here, because this next part is absolutely crucial for locking this remedy into your brain for good. We're going to distill everything we know down to three unforgettable features. If you can get these down, you'll be able to spot Abrotanum with confidence.
So what are they? First, that deep wasting, the marasmus. Second, the crazy paradox of ravenous hunger. And third, this really strange phenomenon called alternating symptoms. Now let's break each one down.
Okay, let's dig into this wasting, because it's not just any kind of wasting. It has a very specific pattern. The emaciation in an Abrotanum case has a clear direction. It starts in the legs and moves up the body. You'll see the legs become as thin as sticks, while the face is actually the last part to be affected. Remember that. It starts in the legs and moves up. That's a huge clue.
And here we are again, back at that wild paradox. This poor kid is eating like crazy, maybe even crying for more food. But it's like none of it sticks. Nothing is getting absorbed. The food just passes right through them, undigested. It's a classic picture of malabsorption, where the body just can't use the fuel it's being given. This total disconnect between intake and outcome is a hallmark of the remedy.
And number 3, we have this fascinating concept called metastasis. This is where complaints just move around the body. An issue in one area gets better, but then, poof, a totally different problem pops up somewhere else. It's like the illness is playing a game of whack-a-mole in the body. It never really goes away, it just pops up somewhere new.
Okay, so we've got the physical picture, but what about the mind? Because as you know, this kind of deep physical illness almost always shows up in the emotional state.
So yeah, the Abrotanum child is not a happy camper. They can be extremely irritable, cross, even violent, with this deep anxiety and depression. But I want you to really focus on this last one, an impulse to do something cruel. I mean, that's a really specific, unusual, and powerful mental symptom. When you see that, your ears should definitely perk up. All right, so we've got the general picture, we've got the mind. Now let's really dive deep into the specific physical symptoms, especially this idea of wandering pains. So, this is the big question, right? What actually happens when these complaints start moving around? When you suppress a discharge or stop an illness in its tracks, where does all that disease energy go? Well, with Abrotanum, it's not gone. It's just moved.
And here are some classic examples of how this plays out. Say a patient has diarrhea, you give them something to stop it, and bam, suddenly they've got gout. Or their rheumatism starts to feel better, but now they've got painful piles. And this can get really serious. Suppress rheumatism, and suddenly you could be dealing with major heart symptoms. The problem was never actually solved, it was just shoved deeper into the body.
Okay, this is so important for any student of homeopathy. How you tell Abrotanum apart from other remedies that also have marasmus. Let's put them side by side. You've got Nat Mur, where the wasting is really marked in the neck. Cilicia, with the large head and offensive sweat. Calc Phos, with a weak spine and slow development. And Tuberculinum, where they lose weight while eating well but have that strong family history of TB. But see how Abrotanum stands out? It's that unique combo. Wasting starts in the legs, that crazy hunger, and the wandering symptoms. That's its signature.
So let's talk about those rheumatic pains for a second. What's really distinct about Abrotanum's rheumatism is you get a ton of pain, but often not a lot of swelling. The gout, on the other hand, is your classic inflamed, swollen, stiff, painful joint, especially in the wrists and ankles. And with either one of these, you have to ask the question, what was suppressed right before this started?
All right, we're in the home stretch. Let's talk about the rules of the remedy. You know, the modalities and relationships. This is the practical stuff you need for a good prescription.
Okay, modalities. So important. What makes the patient feel worse? Well, cold air, nighttime, cold, damp weather, and of course, after a secretion is checked. Now, what makes them feel better? Motion is a big one for their rheumatic pains. And here's a really interesting one. They feel better with a loose stool. And that makes perfect sense, right? If checking diarrhea causes all these other problems, it stands to reason that getting it moving again would bring some relief.
Remember, no remedy is an island. Abrotanum often follows well after remedies like aconite and bryonia, especially in something like pleurisy. And when you're thinking about that super weak neck, you should always compare it with Aethusa and Calpol, just to be sure you have the right fit. Knowing these connections just helps you fine-tune your thinking and really nail down the right remedy.
So I want to leave you with this one question to take with you in your studies and in your practice. Whenever you see a case where one illness disappears only to be replaced by another one, when you see that pattern of wandering symptoms, that metastasis, always ask yourself, could this be a case for Abrotanum? That pattern is the Abrotanum signature, and I promise you, once you really learn to spot it, you will never forget it.